Good evening from Athens. Good morning to our speakers and audience in the United States. My name is Claudia Karidis. I'm Vice President of Public Affairs. On behalf of the administration of the American College of Greece, I would like to welcome you to our event titled Public Health, the Greek Economy, and Political Liberty, Balance, Priorities, and Policies in the Age of the Pandemics, an event organized by the ACG Institute of Growth and Prosperity as part of the ACG 150 event series. Even though the pandemic doesn't allow us to have you physically present on our beautiful and vibrant campus, as it would traditionally be before COVID, we are still excited to have you virtually with us for what we expect to be a very stimulating discussion. We are honored to host today, on this occasion, a group of thought leaders representing different professional backgrounds and actually joining us from different parts of Europe and the US. We aim at engaging them all in a very thought-provoking conversation among one another and with our ACG administrators. Please note that we had initially invited Deputy Minister for Mental Health, Zoe Rapti, to offer some introductory remarks, but unfortunately her program changed last minute and she had to be at the Parliament for a discussion in the Parliament. Also, Deputy Minister of Labour and Social Affairs, Domna Michailidou, had planned to join us online, but again, unfortunately, last minute she had to extend the trip of hers in northern Greece. She's, as we speak, on the plane returning to Athens. However, Ms. Michailidou has sent us a brief message, videotape message, that we will all watch together in a while. Attempting to balance health, economic prosperity, and political liberty, providing practical solutions to address simultaneously all three areas can be for sure a very difficult task. We hope that today's event will provide a further basis for collaboration of our institution with both the private and public sector in our joint struggle to overcome the current and future pandemics. And now I would like to give the floor to the President of the American College of Greece, Dr. David Horner, who is actually joining us from Boston. Mr. President, the floor is yours.
Thank you, Claudia. Over its nearly 150-year history, the American College of Greece has consistently innovated to address societal needs through education. Following both its founding in 1875 in Smyrna, Asia Minor, and its relocation to Athens in the tragic aftermath of the Smyrna catastrophe in 1923, ACG pioneered education for girls, first in Turkey and then in Greece. In the 1940s, the college educated Greece's first social workers to assist in the post-World War II recovery. In the 1970s and 1980s, ACG introduced psychology, marketing, and information technology as academic disciplines to Greece. In Greece's economic crisis, ACG undertook initiatives including the Venture Garden in partnership with Hellenic Initiative to spur entrepreneurial formation in Greece, the Stavros Niarchos Foundation Scholars Program for Greek public university students to study in parallel at Dori, to build their skill sets and enable them to contribute more substantially to the nation's economic recovery, and the Institute of Public Health in partnership with the Baracus Foundation to reduce tobacco consumption, especially among young people in Greece, a major current and long-term public health and economic issue. More recently, and as part of the college's ACG 150 strategic plan, we established the Institute for Hellenic Culture and the Liberal Arts to promote the distinctive Hellenic values inherent in Greece's classical, Byzantine, and modern history, the values of excellence, stewardship, and liberty, as a foundation for the nation's sustainable economic and social vitality. And we also founded the Institute for Hellenic Growth and Prosperity to address public policy and other barriers inhibiting growth and development of key economic sectors in Greece. During the COVID-19 pandemic, ACG pivoted to online instruction enhanced support for students' learning and personal well-being, increased financial aid to students and families, and contributed directly to the broader community's needs through blood drives and production of face shields for local hospitals. The college's new biomedical sciences program initiated a partnership with the Tufts Center for Drug Development, offering for the first time in Europe a professional certificate in this critical area of economic development and public health. Building on this history of innovation, collaboration, and social contribution, and aiming at the 150th year in 2025, the college is committed through its ACG 150 strategic plan to supporting Greece as it emerges from the pandemic and shares with the rest of the world the complex challenge of both growing its economy and cultivating a sustainable, adaptive, resilient society. Today's panel will begin to address these timely and crucial themes. I am therefore pleased to turn the program over to Professor Jay Sammons, our Vice President for Strategic Initiatives and Executive Director of our Institute for Hellenic Culture and the Liberal Arts, to introduce our distinguished presenters. Thank you to our panelists and our audience for joining us today.
Thank you, President Horner and Vice President Karidis. Indeed, we are taking on a challenging task today because we're here to address the future and not simply to critique the past and the present. As a Greek historian by trade, it would be shameful if I didn't mention my favorite author, Thucydides, who 2,500 years ago also faced and survived a pandemic, and who believed that the past should be used as a guide to a better future. But a man has to know his own limitations, and I'm an expert on Pericles and the Parthenon. I need some experts in the modern world, the current world, to help. And I'm really glad we have a panel of distinguished experts here today and my learned colleagues from the American College of Greece to address the major topics that we've chosen. The goal is relatively simple. We want to show that our preparation for the future must include attention not only to public health, but to the idea of the health of the economy and to political liberty. The pursuit of safety alone, without considerations of things like values, culture, liberty, that has never characterized Greek culture or the culture that Greece has transmitted to the West. So it's perhaps fitting that we're addressing these topics this year in the 200th anniversary of the beginning of the War for Independence and the 2,500-year anniversary of the end of the Persian Wars. So first I'm going to introduce our distinguished panel, and then we'll hear from the Deputy Minister, and then we'll begin the panelists' opening statements. Our panel today consists of Professor Nikos Alivizatos, Emeritus Professor of Constitutional Law at the University of Athens, Dr. Andreas Andreadis, CEO and co-managing partner, Sani Ecos Group, and Honorary President of SETE, Professor Manolis Thermizakis, Professor of Genetics at the University of Geneva, Director of the Institute of Genetics and Genomics, Mr. Aristos Doxiadis, well-known economist and partner at Big Pie Ventures. And finally, Dr. Haris Pastidis, President Emeritus and Professor Emeritus at the University of South Carolina, an epidemiologist, and I should add, a trustee of the American College of Greece. Welcome to our panelists. Now, before I offer each panelist a chance to make his opening remarks, I'm very happy to have a statement from Greece's Deputy Minister of Labor and Social Affairs, Domna Michailidou, because our discussion has to touch on future government policy. And indeed, I hope this discussion and discussions like this will influence future policy. It's very appropriate for us to have a government representative set the table for us. So I welcome the Deputy Minister.
It's been a year since COVID-19 was declared a pandemic by the World Health Organization. Around the world, more than 2.8 million people have died from the virus, and billions of lives have changed in the last year. Sadly, millions of people have faced a severe economic impact. Many have been driven into extreme poverty, and social inequalities have arisen. In Greece, the government took decisive measures early on. Therefore, Greece has not yet observed the number of deaths and COVID cases compared to other EU countries. The Ministry of Labour and Social Affairs has been having a leading role in alleviating the negative impact of the pandemic. Besides supporting employment, wages, and the labour market, the Ministry has been responsible for taking actions for the support of less advantaged citizens. In the field of social affairs, in order to combat rising inequalities across both different income, age, but also gender groups, we have adopted schemes that would allow citizens to remain at home while being able to use public services. For example, citizens were not required to visit public services, as all services were provided through email or phone calls. We have also provided emergency benefits to low-income households, have designed special purpose leaves for individuals with dependents, and we have deliberated and implemented the strictest protocols and monitoring mechanisms to protect individuals hosted in private and public care facilities. In 2021, we will be extending our social safety net with both passive and active policy actions and activities. We have increased our national social safety budget by 1/4. We will be setting out a €2 billion plan for social policy funded by the Recovery and Resilience Fund, and we will be implementing a bundle of measures focusing on child protection, poverty alleviation, and disability inclusion to further support citizens, curb inequalities, and improve their welfare. Thank you very much for the invitation. I would have hoped that I would have been there with you, but unfortunately, I'm in the northern part of the country and not able to continue the discussion with you. Thank you very, very much.
Thank you, Deputy Minister Michailidou. Now, before I ask each of our panelists to make his opening remarks of 3 to 4 minutes, I just have to set some ground rules. I'm still a college professor, and as such, I will play the role of tyrant of time. So, watch for my finger, gentlemen. But I'm looking forward to hearing your opening remarks, and we will proceed alphabetically and begin with Professor Alivizatos. I think you're muted, Professor.
Thank you very much for the invitation. In a recent article, Yuval Noah Harari, the well-known Israeli historian, rejects the well-established view that humanity is helpless in face of pandemics. On the contrary, based on the COVID-19 experience, he maintains that in the field of science and technology, the tools have been there. From the perspective of my own field of interest, that is constitutional law, I would tend to say the same. All branches of government, including the judiciary, which is usually the most conservative one, both in Europe and in America, proved to be much better prepared than they were, let's say, in the 1930s, when they were called to face the big recession. Quick reaction in terms of urgent legislation and government action aiming not only to slow down the spreading of the virus and assist the disadvantaged, but also to enhance research, expand health systems, and strengthen infrastructures. The production of at least 4 different vaccines in less than a year's time was the most spectacular, yet not the unique achievement of that preparedness. In a way, I would say that COVID-19 has helped the revival of what came to be known in this side of the Atlantic as the welfare state, which is the European equivalent to Franklin Roosevelt's New Deal. Generally speaking, and at a high level of abstraction, the above picture is true. In the current pandemic, the West, if not humanity as a whole, have reacted in a much more efficient way compared to the way they had reacted in facing comparable challenges in the past. Still, however, the death toll is too high and the suffering too extended to let us reach such an optimistic conclusion without question marks. As put it by the same Israeli author, the tools have been there, but all too often the political wisdom has been missing. What is just political wisdom, or what is a deliberate refusal, or was it a deliberate refusal to cope with some very crucial dilemmas of a new era? If yes, which are those dilemmas? Let me start with the international level. I would first mention the need for cooperation for the purpose of establishing a powerful global system to monitor and prevent pandemics. The World Health Organization is there, but it needs more money and, above all, some political clout. Moreover, at the global level, specific measures are needed to safeguard our digital infrastructure and protect us from a host of greedy big brothers. As an American author put it, we should revisit, and I quote, the in-flight marriage of Wall Street and Silicon Valley in a way as to turn it from the benefit of humanity, and not only to the profit of brokers of the globalization era. At the national level, the most obvious lesson from the current pandemic is that more investments are needed to strengthen public health systems. Can this be achieved in a country like Greece, which, for geopolitical reasons, has to invest disproportionate amounts of money for its defense? Here is perhaps the major dilemma that Greek governments will be facing in the next years. Finally, at the local level, I am tempted to say that for societies like ours, which privilege compassion over rational thinking and slogans over well-articulated arguments, the magic words are, in my opinion, two: solidarity and volunteerism. To remind you of the ancient Greek distinction between the notion of life, zoe, which is rather seen in the biological term of the world, and the notion of vios, which is closer to the concept of well-being, I would say that it is not worth leaving the first without the latter, and that the latter cannot be achieved without a minimum degree of mutual assistance and understanding, which depends from our willingness to give more than to take. Thank you very much.
Thank you, Professor Alivizatos. Dr. Andreas Andreades.
Hello, thank you so much for the invitation. Obviously, coming from the big business sector, I will approach it from another angle. There is no doubt that with this pandemic, we enter in travel in a completely new era. In my long experience in travel, when I was asked many times by investors, what can go wrong with your business, I tried to recall over 35 years all things that went wrong during this time regionally and globally. Wars like Yugoslav War, the Iraq 1 and 2, Middle East flare-ups, terrorism, 9/11, episodes between Greece and Turkey, global financial crisis, etc., SARS, MERS. Never the needle of tourism went more down than 10 or 15%. And the irony is that during the last financial crisis, when the global economy went south and the Greek economy dipped even more, the tourism in Greece flourished, adding hundreds of thousands of jobs and a spectacular growth. So now we have entered a new era with this pandemic, reminding us how vulnerable our business can be and how much can we depend on the right policies, on prevention tools, on the investment in health, in proper governance, and the global cooperation. Honestly, in my career, I never thought that my business would be so much dictated by what politicians and health officials were going to do, but here we are. How quickly can this business recover? We still don't know. and it will depend, obviously, at the global pace of vaccination, advances in medical treatments, possible variants emerging, and mainly on a cooperation at a global level that we still don't see there. It's very sad to see countries acting selfishly and politicians tending always to err on the populist side, disregarding the damage to people's lives, including their health, distraction of healthy businesses, especially small and medium-sized, particularly tourism is relying on small and medium-sized businesses, and obviously loss of tens of millions of jobs. The balance of decision-making in this pandemic was certainly not found. Some countries disregarding risks, solidarity not showing up. I can mention easily between the European Union the difference between the North and the South. The South countries, including Greece, that I have to say handled very well the pandemic, welcoming open borders, and the Northern countries that export tourism, not welcoming open borders. And this difference and vision is still there. It's very disappointing to see that. Still, solutions are not easy, but finally sanity has to prevail. And obviously the media and the social media in our times also played a very specific role in spreading fear and using this deep instinct of human nature to fear the disease against the developments in the economy. In any case, our business will rebound. This is sure, starting in 2022, barring any very unfortunate developments. There will be seismic changes in the travel business with whole sectors. For example, business travel, conferences, the cruise business impacted long term, and obviously other sectors like leisure recovering much faster. What certainly we will see is a huge transfer and concentration of wealth. There will be huge segments of the people that are not so well off in a big part of the undeveloped countries, where they will get much poorer and wealth will concentrate much more, even more than it has today. So that's one of the certain things that we will see after the pandemic. There will be a need, obviously, for a much more sustainable travel. The initiatives are for businesses to address fast issues as zero carbon, zero plastic, and zero waste, and this will dominate the agenda in travel and not only. The need for the global task force, as Professor Alevizatos explained, to address the next pandemic will also need to be addressed. The WHO clearly was incapable, proved incapable to have the cloud to address this. And in the end of the day, let us all hope, to close my introduction, that this minute pathogen will make us work closer together towards a future that where we appreciate more our fundamental values, the importance of health, the solidarity, a deeper understanding of each other, and that we are, in the end of the day, all universally connected in this planet and drive us towards a more fair distribution of wealth and fighting inequality. Thank you.
Thank you, Dr. Andreadis. Professor Demizakis.
Yes, thank you. First of all, thanks for the invitation. I would like to start from a completely different perspective, which is something that is closer to my heart and something that we've been actually faced head on as society in general, not just me and my field, but even people that have nothing to do with science in their daily life, and that's research. This is something that has become part of the daily life of every person. Looking for individual results, the latest results, even results that have not been even what we call peer-reviewed, still not very clearly confirmed by other studies. And they found all this information found itself in TV channels and news, and people are aware of it. And actually, society has been using even weird words that I find that I actually found it quite entertaining. Words that I thought were extremely esoteric in my field were actually used openly by grandmothers and grandfathers and people that have never been exposed to this language just because they see it every day. And that basically shows that I think this pandemic, what it brought and what was the biggest thing that is going to have an impact is the familiarity of every single person, regardless of where they come from, to the exploration of our world. And in more specific ways, to the exploration of life, and even more specifically to the interaction of the human body, human biology with the environment. In this case, it was a virus, but of course, we have many, many other interactions that are with other living organisms or the environment or other things that impact our life. This is good in some way because I think that the ability of people to understand exploration of the world is very important. But at the same time, it exposed the weaknesses of what is otherwise the magic of science. I think what I experienced in Greece and actually even in Switzerland and other places is that scientists before were those people that were universally respected, independently of where they come from and what they say, just because people couldn't quite understand what they were saying. But now that scientists actually have an impact on their daily life, of course, there are people that react. There are people that develop opinions and become opinionated even on specific topics, like whether they should get a specific vaccine or whether it was a good decision to open or close or, implement a certain drug or not, or whether we should actually buy a drug to bring it to Greece or not. This interesting discussion where people have opinions on things that they were not even imagining they had before. And those weaknesses, of course, in the short term will actually be impacting science in a negative way because people have actually lost, the magic has been lost, let's say. And now we're going to a more realization of reality that scientists are also people that have their own weaknesses. So that's one part that is quite important. I think that's going to have an impact in the near future. And we can discuss how this is going to happen and how it's going to impact our life. The other aspect, I think, has to do with priorities. I think we have two dimensions of priorities. One is whether life is worth the same across different countries and environments. We realize that people don't appreciate, don't put the same value on life on all countries and in all regions of the planet, and in particular in relation to economic aspects and political aspects, some of them micropolitics rather than serious sort of, let's say, long-term politics of a country. What it also exposed was a diversity of response. And we had actually a very weird and a differential representation of response that I think when we go to the end of it, we will see that there were different starting points and different endpoints for that response. For example, European countries, and in particular Greece, started doing very well in this pandemic. And they started doing very well because solutions were simple. People backed up those solutions. And then things became actually quite obvious. And that's why we had actually a relatively good year last year, especially in Greece, but in some other European countries, relative, for example, to the US or even the UK, that is not part of the European Union strategy. But we see now that when we're relying on infrastructure and organization of science and the ability of those countries to modulate, to mobilize different forces, like, for example, production of vaccines, we see now that the US and the UK are actually taking over, and they're going to get there much faster because they could get the vaccines, they could produce the vaccines. Companies that produce the vaccines are actually US and UK companies. And so in some way, we see the differential strengths and actually the comfort of Europe losing probably more at the end than what was expected. relative, and vaccinations is our key weapon here, is our key tool to be overcoming this pandemic. And it's going to make a difference if we have vaccination at very high levels or very low levels over the next 6 months. The final thing I want to say, because there's going to be a lot of other aspects of the discussion, is that I think this pandemic opened up the question of other pandemics that we have. When we've been talking about this pandemic, we actually put a lot of resources, billions or trillions of dollars, not only for actually taking care of people, but actually taking care of the economy and other consequences because of the measures. But we never had any measure like that for other pandemics that I call them chronic in the way that I would call this an acute pandemic. We never had this kind of response for diabetes, and we never had this kind of response for other diseases that are actually in a very high proportion in life. And I think that would be an important point to bring up, because we constantly have pandemics that are currently in every point in our life, irrespective of this particular acute one.
Thank you, Professor Demizakis. Mr. Doxiadis.
Well, I'm very, very happy to be here and participate in this discussion. Thank you for having me. I'm going to speak a bit in my capacity as an investor in technology, because as an investor in technology, I am by profession, but also by character, I think, an optimist. And I have seen some silver linings in this disaster, which I'd like to very briefly go through. First has been the very, very rapid adoption of digital solutions in many walks of life. We have adopted remote work practices, remote cooperation practices, online shopping to an extent never seen before. Older people have learned how to use video conferencing to meet their family or to view lectures from the comfort of their living room. So the adoption of digital practices has been one silver lining that should have enduring positive results. The second has been very rapid progress in the medical field. We have all seen how vaccine and drug development have accelerated during this crisis, but not only that. We have seen a proliferation of what is called point-of-need diagnostics, very simple, cheap devices, cheap technologies that anyone can use to diagnose a difficult disease, even in the remotest village. We have seen some flourishing of telehealth, giving advice or diagnosing from afar and so on. All of those have been combinations of data science with new laboratory techniques and new developments in material science. In the end, these developments are going to mean better health at lower cost, better public health as well as individual health at lower cost, which means smart spending rather than more and more spending by the states. The states have many other needs, so it will be good if we can get good health solutions at lower cost. The third silver lining has been specifically Greek, or a few other countries like Greece. It has been brain regain. Greek migrants who had left, coming back here and working remotely. I'm sure all of us know cases like that, highly skilled people who have come back to their home in Athens or in villages, and they work for their current employers. Maybe at some stage they'll change employers, but still stay in Greece and work. This potentially can be a great benefit to our innovation ecosystem, or more broadly to what is called the knowledge economy. And then there are two trends for the future, two big ideas that have gained support during the pandemic and I think are valuable ideas. The one is the awareness that resilience in supply chain or in production should take priority against efficiency. In the past 30 or 40 years, the big motto of business has been efficiency. Use as few materials as you want, just in time, don't keep stocks, etc., etc. Everything should work by the second. We have now realized that we need redundancies. We need to keep some material supplies here and there. We need to have some practices that are not as efficient, but can survive when such a crisis strikes. The other big idea is that while knowledge is diffused more and more globally, and we have seen this in this pandemic and how scientists around the globe have cooperated, production should perhaps be refocused locally. This is the way to have more robust supply chains, to have small local factories that use global patterns, global design, but to produce locally. So thinking about the resilient supply chains. So I think these have been the good trends from a technological point of view. And I will also mention very briefly one political trend. It has opened up, the pandemic has opened up the discussion for new practices for international cooperation. And we are at a crossroads here. Will this mean more robust international cooperation, or will it mean, renationalization of various decisions? The EU, I think, is at a crossroads here because we saw what happened with the procurement of vaccines. It was the first time that such a big project was undertaken by the bureaucracy in Brussels for all the member states. And in principle, this was a good thing. However, in practice, it was performed very, very badly. It was a fiasco. Therefore, one reaction is to forget the bureaucrats and transactional bureaucracy of the EU. Let's do it nationally from now on. The other reaction is to say, we need this, but we need to do it much better. And therefore, let's reform the management practices of that bureaucracy. And on this, I'm not optimistic. I have no idea which of the two trends will prevail. Thank you. You're muted.
Sorry about that. Thank you, Doctor. Thank you, Mr. Doxiadis. My fault. Dr. Pastidis.
Yes, well, also, as the other panelists have said, a great pleasure to be with everyone here today. What a beautiful panoply and diverse perspective that has already been provided. I love this topic because public health, economics, political liberty have always been strains on each other. The only exception I take to the title is where it says in the age of pandemics, because as long as there have been people, of course, there have been pandemics. And Professor Salmons, you mentioned Thucydides, your favorite historian. My favorite Greek physician, philosopher is Hippocrates, who was well persecuted in his own day for his advanced findings relative to an essay he wrote that was called Airs, Waters, and Places, and for the first time indicated that there were germs that could be communicated both through the environment and through people within the environment. And he was not only criticized and condemned, but even persecuted for these findings. So public health has always been a villain, if you will, within society. On one hand, we're praised for science and for research and for technology. And on the other hand, we're the culprits for constraining liberties, whether it's travel or having to be socially distanced, which, by the way, Hippocrates also was the first I could find who advocated for social distancing and also for vigorous hand washing, especially during times of plagues and other outbreaks of disease. Greece will face a great moment of introspection and decision-making this spring and summer about tourism. There are countries around it that are opening up widely and saying, everyone come. Yeah, you might have a test before you come, or maybe we'll give you a test at the airport, but we want you. And there are others around the world who are saying, we're not ready for this. New Zealand, some of the Scandinavian countries, we're not ready for you. And the balance, of course, will be the economic well-being of its people on one hand, and possibly the medical or public health well-being of its people, not to mention travelers on the other hand. Public health is not good at making those decisions. We are not the decision makers. It is the Hellenic Republic. It is the people of Greece or of any country who must be engaged with governing authorities. And also, what my great concern is are we going to learn enough about this pandemic to apply it to the next one? I frequently ask this question and often get a 50-50 division in the response. I ask, do you believe COVID-19 will be the worst pandemic in your lifetime? In your lifetime. I ask it of older people and of younger people, and about half the people say, yeah, I think that's it. I think that's the last one of this magnitude I'm going to see. And about 50% of the people say, no, there are going to be more. And I personally believe there will be more. Whether you believe COVID emerged from a research lab or from a so-called wet market, the international community has done virtually nothing to constrain the presence of these sources, if you will. And when there is a novel virus, a novel pathogen that has never been circulated among humans before, whether it goes from pangolin to bat to pig to human or some other species, that will continue to pose problems. I worry that we are not learning, we're not documenting nor learning enough about the mistakes we have made in this pandemic. It's not that I wish to be pointing fingers at people. This is very, very difficult things to do. In the United States, given that we are 50 states with governors making decisions, Florida, for example, is virtually all open. You could go to Disney World today and find it fully open with a recommendation about a mask, but not a requirement. Last night was the biggest gathering of Americans in a single place since 13 months ago. That was at a baseball game. That was in Texas, where over 40,000 people attended a single baseball game. So public health can cry out loud about what people should do, but the only way to do better at this is to educate and to engage the public, to have trustworthy leadership. And I'm pleased to know, especially in the earlier parts of the COVID-19 pandemic, that Greece did so well. I also want to bring up two different parallels, not from infectious diseases, but from chronic diseases, tobacco control and seatbelt use. It has been said that that policies and laws constraining tobacco use, increasing the prices of cigarettes, and also making laws that mandate seatbelt use, that those two factors together have saved more lives, more modern lives on the planet than all of the discoveries that have come before that, rivaling everything but the discovery of antibiotics as a way to save lives. And those were successes, not necessarily, certainly not of the public health community alone. The findings about tobacco use and lung cancer or seatbelt use and fatal car accidents were available 30 to 50 years before governments actually put in place policies, programs, and laws to bring down the death rate. So I want to end by just asking us all to remember that the inequalities that were present in our society have only been exacerbated. And it's so important that with the remaining months of this pandemic that we pay attention to those at the lower end of the economic spectrum with respect, for example, to vaccine distribution. In the United States, it's unfortunately the poorest communities that are not vaccinating themselves at the highest rates. And of course, we can blame them and say that this is a problem with education or ignorance, but it is the responsibility, as was said before, for the authorities to create more of an equity with the distribution of the vaccine. And as someone before said, we're all brothers and sisters across boundaries and across borders. And so what's happening in Canada and Mexico are most important to the United States. What's happening in Southern Europe and the Middle East and the rest of Europe is so important to Greece as well. I look forward to hearing the other speakers. Thank you.
Thank you, Dr. Pastidis. I want to pick up on a point you made there about the difference between states in the U.S. and tie it to the several comments on the EU made by 2 or 3 of our other panelists, and in particular what Mr. Doxiadis said about the need for resilience in the supply chain. Because it seems to me there's related questions about centralization versus decentralization, uniformity versus subtlety, a suppleness and ability to react that localities have or need to have. And so the question I'm sort of pondering is, are we moving to a place where we need this kind of pandemic treaty that was called for by a group of global leaders this week, including Prime Minister Mitsotakis? Interestingly, China, the US, and Russia were not a part of that, but especially European countries. Is a pandemic treaty not needed as well as this kind of local resilience that Mr. Doxiadis talked about? I guess what I'm saying is, isn't there an advantage to having different countries pursuing different policies? Because you get potentially answers to a question that you don't get if everyone is doing the same thing. And if individual localities and states aren't able to take care of themselves in terms of productions and their supplies, they're not able to help anybody else anyway. So that uniformity becomes a goal that sounds good, but perhaps it's not always what we want.
Let me quickly, and then the other panelists, I'm sure, have an opinion. I would not disagree that early on in the pandemic, that different countries doing different kinds of research, different platforms, different experimentation, including social experimentation, was a good thing. However, ultimately, the fact that there are different policies across boundaries for travelers and for people doing business is not a healthy thing. It allows people to play the recommendations how they prefer them to be, or to point to another place and say they're less or more restricted. In South Carolina, I can go to a supermarket and I can cross the border to the same supermarket, the same chain in North Carolina, and have a completely different policy with respect to that. And so I think, and let me say that the vaccine passport, or whatever you want to call it, the COVID passport, is something that we need very badly. It will never be accepted in the United States. It will never be accepted. But as a former WHO consultant, I had a health card that I kept with me whenever I went to developing countries. And that's exactly what we're going to need now. Some Northern European countries are already promulgating this, Denmark and others. The United States will never accept it. How wonderful it would be if we could make this a universal platform.
Can you say why? Can you tell us why?
Purely because of politics, the libertarian streak of the United States, the I don't want to say left or right wing, but the people, there's a motto here: live free or die. Of course, eleftheria y thanatos, we have that in Greece as well. But sometimes with public health, it's live free and die. And so people would rather not be compelled to carry an identity card or a passport. They would rather have that and take the risk of having the vaccine and the epidemic continue. It's personal choice and personal liberties. That's the values of many in the United States.
Well, I think it's a value.
What if it's also live free and kill other people? Because the problem with infectious diseases is that it's not just yours. It's other people's risk that you are promulgating. I don't know how much this is being discussed in the States. I would think that in the European context, this type of moral calculation is pretty common. I mean, somehow we feel that we are not allowed to put, our neighbors in danger as well as us.
I think that's a fair point, but I think it's also true that there hasn't been, at least in the U.S. media, a fair appreciation of the fact that any kind of freedom entails risk, that those two things necessarily go together. We're not going to ever achieve a perfectly safe society. But I take your point, Dr. Pastidis. But I wonder, Mr. Doxiadis, could you say something more about this need for localities to be able to respond themselves and not to be reliant on, other countries?
Right. There's no simple answer to that, because one other thing that we learned during the pandemic, I remember this time last year, everybody was scared that the global supply chains would be hugely disrupted. They were not really. I mean, they stood up pretty well. So resilience does not necessarily mean global production. However, I do think that it makes sense. It also makes sense in terms of clean the environment, not to have so much transport back and forth from China to Europe and the US and so on, that we need to do more things locally. And this will only be possible by automation. And by automation, where you can get a design from somewhere, have a couple of robots assemble some things clearly, rather than by mass production in the so-called Fordist model. If we move beyond the Fordist model and can have small batch local production, this will be very good. However, there will always be some materials in this earth of ours that you cannot find everywhere. Lithium, for example, I think, I don't know what the basic chemical of lithium batteries is, but I know that this you can only find in some very few locations around the world, and therefore you will always need somehow to import materials. So we cannot really hope that in the foreseeable future we can have totally localized production.
Right. There's the point that Professor Dermizakis brought up about scientists becoming human beings before our very eyes as they appear on television and stand behind podiums and become, political and public figures. We've seen the politicization. I don't think it's been as bad in Europe as it has been in the United States, the politicization of the scientific debates. But I wonder, Professor Dermizakis, if you could comment on that and how you react to certain scientists being silenced because they don't share the majority view on say vaccination or on masks or what have you.
Well, I mean, it is a problem, but I mean, I think that we already have these processes internally in science anyway, and I think that there's processes where majority opinions, minority opinions are expressed, and there's discussion and debates. Just that the public was not ready for that. Disagreements between people and between scientists was actually something that people were not expecting. They thought that science is one thing and everybody should have one opinion, and regardless of who you ask, you get exactly the same opinion. So that people were surprised by that. But I think that we ended up in a situation that is more complex. For example, in Switzerland, a few weeks ago, there was a law that was being promoted to the parliament. It wasn't voted at the end, that members of the task force in Switzerland would not be allowed to either express opinions in public, like on TV or radio, or even in social media. They were basically bound completely by the government, and they could only express opinions inside the process of the government. That to me is ridiculous. And the fact that a country like Switzerland that promotes these values in a completely different way actually went in that direction is very warning. And I'm worried that these kinds of things might happen in other occasions, maybe more mildly or more secretly, because they're not as public anymore. And that would be a problem, a huge problem, because science would lose its freedom. Essentially, in some ways, our connection to real world and our presence in real life decisions can compromise our intellectual freedom and our ability to express our opinions completely freely. And how this balance is going to end, I don't know.
Yeah. And you don't just have governments engaged in this. You have big technology, that are making policies based specifically on, positions on things like masks or vaccines or what have you, and actually deplatforming and removing people based on those opinions. Those decisions are not being made by doctors and scientists, right?
Exactly.
And in fact, Dr. Andreades said something about the media, the role the media has played in spreading fear in this pandemic. And I noticed there was an article in the New York Times this week on the difference between the negative press in the United States They were comparing it with EU press and with local press. But the point was simply that the media has played a major role in forming public opinion here, and that it's tended to be leaning in the negative direction. Unlike Mr. Doxiadis, the optimistic economist, we don't see too many of those around here. Dr. Andreadis, do you want to comment on that? Oh, you're muted.
Diverging slightly from Professor Dermisakis, understandably so, although he's a very optimistic and very knowledgeable guy that I read very frequently. And it's normal, I'm coming from the business world. Here we have a once in a century event. And the human nature is super afraid of these things that are unknown. That's a fact, okay? So it's logical that this is playing in the media, and in the era of the media is playing so prominently compared to other diseases that happen every day, and people are killed every day from all sorts of other things. Understandably so. So if this happened 50 years ago, I'm pretty sure this thing would not be the case, right? So this thing then reflects to the government and reflects to professors and doctors of medicine who are parts of task force or not, who are the government officials are tending to err on the conservative side, because no politician, I have to say, with the exception of Prime Minister Mitsotakis and very few others, and yesterday was a very good example of Boris Johnson, despite the fact that numbers are going so much down in the UK, he is erring on the conservative side. Why? And killing businesses. Why? Because he is never going to win anything by erring on the side of opening faster, because he will be accused. And obviously no doctor is willing as well to err on the risky side. So we have two roads of thinking here, which is exasperated by the media. And therefore, instead of seeing how many deaths we have in thousands of other diseases and people cannot go to hospital, or how many people get unemployed or get nervous breakdowns or divorces or whatever, we are creating a lot of damage. And my sector is particularly hard hit, and especially the small and medium. I mean, we have at least a few 100,000 unemployed workers in tourism in Greece, still waiting to open the business, and they are living now for 2.5 years with 530 euros per government subsidy. So, we have to think of all these people as well, right? So, I mean, we have to find the balance. The balance is not found. I'm not accusing anybody. It's natural because it's such an odd event that happened. But let's try now to bring some sanity from now on.
Yeah, I think this is a very powerful point. Your point about Boris Johnson in particular, because it seems to me that democratic governments and media together create an environment in which it's extremely difficult for a politician to say, hey, I thought something 3 months ago, but that's when we didn't have this new information. And the information we have now is different. And so we're going to need to change our policy a little bit. But the changing of policy is seen as such a weak and a losing move by the media. And if you take the pandemic as an example, the infection mortality rate was thought to be extremely high when you think of what people thought a year ago about what was happening in Italy. And this Dr. Ioannidis at Stanford just released a paper this week showing the infection mortality rate as around 0.15%. I mean, so incredibly low compared with the fears that people had a year ago. But politicians don't seem to have the space, to make those changes. How do we create that space for them?
But that number is not true, right? We should be careful about that.
Sorry?
I mean, what I'm saying is that the paper that came out that Professor Ioannidis published, it is an estimate, but it's not accepted by the vast majority of the community. So, yes, it's not like the Italy, but it's, the mortality rate, the case fatality rate, which is actually the what is being estimated, is so high that it clearly justifies all the measures that were being taken. Because otherwise, you see now there's deaths even when, half of the people that were considered vulnerable are vaccinated. So I don't think that we're talking about a case fatality rate that was so low. That means we exaggerate on our reaction. But clearly, the first impression is always more the mortality rate was much higher in our first impression than it is now. But not that it was an insignificant one.
Even the CDC was putting it at 0.5 or 0.6%. So that's significantly higher than 0.15%. But okay, there's a fatality rate that has to be dealt with. I appreciate that fact. But we have certainly seen things change over the course of this. Nobody is wiping down their packages now with disinfectants when they bring them into the house, right? So people's fear level has changed too. But we still don't seem to have created the space for our politicians to make some kind of changes and to talk about the effect on businesses, on little businesses, right? We're not worried about Amazon. We're worried about the pizza shop around the corner, the taverna that can't actually, serve in its place. Mr. Doxadis, do you want to comment there?
Well, I'd say that people in general tend to recognize extraordinary circumstances as they happen, and they realize that extraordinary threats means that we cannot keep living as we used to live. But this sentiment of emergency tapers off over time. I mean, the threat from the virus may not have become lesser, but it has become normal in a sense, in the sense that it's lasting longer. And therefore people start saying, well, we have to live our lives. I think to some extent it is as simple as that. Yeah. There's also one thing that I would like to say, that I was thinking about the cultural issue of solidarity. As we said earlier, this kind of disease doesn't just kill you, it kills other people if you're not behaving in a certain proper way. Therefore, not putting other people at risk is an ethic of solidarity. In Greece, what we did see in the first few months was that people were scared, but they were also able to buy into the narrative that I'm not just protecting myself, I'm protecting my grandparents, my father, my elderly neighbor, etc., etc. And this was pretty strong in the first few months of the pandemic. But this was because it made us Greeks feel good about ourselves. We're very good at acting in solidarity out of our own initiative. However, when this becomes a rule enforced by some authority, and our own initiative sort of tapers off, then we're less good at sticking to the rules that somebody else has mandated. I think this has been pretty clear in Greece over these past 18 months. I really don't know whether it has been the same in Northern Europe or in the States.
That's an excellent point about different cultures. Dr. Bastides.
Well, only to remind us that officials, politicians almost never are condemned for overreacting, only for underreacting, whether it is snow removal in New York City, hurricane evacuation in South Carolina, forest fire response in Athens or in Greece, only condemned for not doing enough, never for doing too much. One exception in this country is the governor of California, who was one of the early lockdown proponents, and California stayed locked down far longer, and he is now the subject of a recall by his people. And so I also want to echo what someone said. The media has not played a good role through the pandemic, at least not in the United States, because good news does not sell, only bad news.
Yeah.
And the price for a 1-minute advertisement in the evening news now is approaching half of what 1 minute at the Super Bowl would be, because families were in their home waiting for the evening news to find out how bad things were. And right. So we have to, in the future, work with the press, not to censor them, not to manage them, but to work with them to try to give realistic assessment so the public would have a better view.
I want to ask that's a great point. I want to ask a very specific question about Greece and bring in Professor Alivizatos and get him to talk to the scientists about this. It has occurred to me that Greece has so many different, you might say, microclimates, microenvironments, from the islands to Athens, the urban center of Athens, to the Peloponnese, to the mountainous center of Greece, that I suppose one could argue that making one policy for dealing with a pandemic across all those different environments maybe doesn't make sense scientifically, but maybe it makes sense legally. I mean, is there a way, Professor Alivizatos, that policy could say, well, on the islands it's okay to do this, but in Athens you have to do that because we've got this metropolitan transportation system where we have people, in close proximity. Is that a possibility within Greece, or does the law make that impossible?
I'm smiling because we have had some days ago a long discussion in Greece about civil war during the revolution of 1821. We have had 3 civil wars during, the War of Independence. And a colleague, a historian, said that it would, Mark Mazauer, by the way, said that it would have been a surprise if we didn't have civil wars at the time, because there were so many differences between the islands, for instance, Peloponnese and Roumeli, and entrepreneurs on the one hand, intellectuals, and the local cacique, that it was almost normal. Since then, however, much has been done, and I would say Greece has been a very centralized state in terms of education, and I would say culture as well. The differences are not so important as one would have thought in the 19th century, I believe. There is a tendency to have similar approaches between very different parts of the population, due not only to the school system, to the role of the church, which is also essential, but also to television, the culture that comes out of very popular shows and so forth. So I don't believe that that's really an issue. Although I have the feeling that in some respects it could have been very profitable if we could adapt some general principles to local situations. But this is something that should be done. I don't think that so many important differences do exist today between, let's say, even the most obvious different parts of the country.
Yeah. What do our scientists think about that? Does that make any sense to have different approaches in different environments, urban centers, rural environments? Is this?
I would say that if I may say just a word, the only concept I've heard from scientists, of course, is to have COVID-free islands, which is difficult to do in the mainland of Greece. COVID-free island is something that Mr. Drimidjakis will tell us. It's much easier to achieve it than in the mainland part of the country.
Sure.
Yeah, if I may say so. Yeah, I mean that's clear because islands are, especially in a situation where it's a lockdown. People moving to an island or from an island is always very difficult. So it's easy to sort of secure them and make them COVID-free. I think that it depends. The aspect of whether you can have measures at a local level depends on the resolution of what we call local. It's one thing to say to have a specific measures for a village, and it's another thing to say to have a specific measures for half of Greece or whole of Greece. And I think that you can relate to that from the U.S. perspective. But the U.S. as a country is almost impossible. It just doesn't work. Not only because there are 50 states, but because there are different aspects of the environment, different densities of people, different ways of even different ways of people functioning. But I think there is something to be said about adapting principles to specific areas, even when it comes to sort of natural aspects of a country. For example, where we are right now, if you can justify people staying at home and blocking the virus when you're in Northern Europe, where the weather is not very good and the sun is not very a common thing. Where if you are in Greece, where the sun is always there and the temperature is above 20 degrees Celsius, there is actually some value to go outside, because that's where you block the virus the most. There's a huge difference between indoors and outdoors. So adapting principles like social distancing and dropping the transmission to the specific advantages and disadvantages of a region, that can be, of course, done by country, because that's how you can implement measures, is actually quite important, because there is quite a diversity of those things. So to that resolution I can understand, but going to much higher resolution between cities and country and villages, I'm not sure how easy that is.
All right. I can feel my colleagues at the American College of Greece itching to get involved in this conversation and thinking Jay is talking too much. So I'm gonna bring them in now, the unit leaders of the ACG 150 centers and institutes, and let them comment or put a question to any of you they wish. And I'm going to start with my colleague Michalis Saladopoulos, who is our chief consultant and the chair of the advisory board for the Institute for Hellenic Growth and Prosperity. Welcome, Michalis.
Thank you very much, Jay, and thanks to all the speakers. This has been a very varied but completely captivating event, and I guess this is shared by our audience. Let me say that I consider myself to belong to the group of optimists because of the way we adapted to the pandemic, not only in Greece, but globally. A special mention should go out for the European Union and the United States, although here we see differences that have been addressed by the speakers. For example, President Biden's package seems to be huge, and I'm very impressed by what is going to happen in the American economy, provided that the flow of funds continues as planned. Whereas, of course, in Europe, despite the flexibility shown and the Stability and Growth Pact have been disabled for a while, one sees the volume and questions himself if this is enough. And to now move from the macro level to the micro level and address what you have been talking about lately with the COVID-free islands. Of course, to keep the islands COVID-free, you need to introduce the vaccine passport that Mr. Pastidis mentioned. But what if certain people claiming it is their personal liberty refuse to get vaccinated and get this passport? What will happen then? Do we have a question for that? An answer for that, sorry.
Professor Alivizatos.
That you cannot, I mean, the question has been posed for doctors and hospital personnel who have refused, as you know, in some places in Italy, but in Greece as well, the Metaxas hospital in Piraeus the other day, to be vaccinated. In my opinion, you cannot oblige someone to be vaccinated if, for serious reasons, he does not want. But you can very easily decide that, look, you should stay. You cannot enter an airplane. You cannot enter a bus. You cannot go to your work. I mean, it is, in my opinion, absolutely obvious, especially when your job is very closely related to the health of other people, such as hospitals, I would say hotels at a lower degree, but with the same logic. Now, going to a specific geographical area, and in particular to an island. In my opinion, under the continental European constitutional civilization, if you say that you are not free to enter the specific island of Ios, for instance, if you don't have the vaccine passport, you do not contravene the constitution. You do not violate the constitution. You can do it. You can freely do it, because the advantages of protecting the other people and of securing economic, tourism, economic life, and so forth, would be balanced to overcome the difficulties of personal freedom and so forth.
I appreciate the fact that we have another one of these optimistic economists at the head of the Institute for Hellenic Growth and Prosperity. We're running across them everywhere here today. But he did bring up the subject of debt or spending, stimulus spending. And of course, when we look back on this situation, we're going to have to decide how much money has been spent, deficit spending has occurred, and the only way those monies are going to be paid back is if we have businesses up and running and taxes being paid. So I suspect that Dr. Andreades wants to see that money.
If I can, Professor Simons, if I can ask comment. Look, we have a very clear roadmap. I mean, I have an experience of tens of thousands of guests who came to my resorts last year. We opted to test everybody upon arrival, and we didn't have a single COVID case, even in the middle of last year's flare-up. So my opinion is very specific and very clear. The vaccinated people have to do a PCR before departing.
No one protested?
Sorry?
No one protested?
We are testing last year and this year everybody on top upon arrival to our hotels.
And no one protested?
No one protested because we informed them in advance to be tested. So, look, people vaccinated, I mean, I really fail to understand why tourism has to be blocked, because all this printing of money, to be honest, even by the ECB, in the States, the things are easier because you don't have all these subsidies. In the small businesses in Europe related to tourism and not only, it's impossible for the state to redistribute the lost money in a proper way as the open economy is doing. So you are going to favor and you are going to punish businesses and people. So there is no way to substitute this thing by printing money. Okay, let's start with that. So you have to start business again. And tourism is a big business, not only for Greece and not only tourism. It's about, airlines and many others. So, you have the vaccinated people, and obviously vaccinated people will be tested before departing and again before coming back. So that's one. Then you have the unvaccinated people that need obviously to do a test again upon arrival and departing again. And maybe in specific high-risk countries with the variants, you have to have a short quarantine. So I don't understand why all the economy of Europe has to wait, whereas in the States, the CDC said, you're vaccinated, you can travel all over the US. Why in Europe, you are not able to travel from one country to another? And why we have this issue? Okay, maybe today we still have the third wave, but in a month's time. The problem is the politicians don't want to commit on a date. You cannot have an airline filling up in 1 week, Doesn't work like this. You have to give a date and say, on the 1st of July, on the 1st of June, we will open the borders. And, you have to risk it as well. And if very bad happens, so be it, you can change it. But you cannot just leave it like this because you kill all business.
Well, it's important to remember that any spending that is engaged in by any government entity in the end has to be paid for by somebody who has a job. I mean, whether it's this generation or the next generation or the generation after that. Thank you, Michali. I want to bring in the next ACG 150 unit leader, which is Dr. Stella Apostolaki, who is the chair of the Academic Advisory Board for our Center for Sustainability. Dr. Apostolaki.
Yes, hello. Thank you for this very interesting discussion. I would like to put a slightly different dimension to this discussion and refer to how the COVID-19 pandemic has threatened environmental sustainability in human societies. At the moment, based on the current population growth rate, the planet's carrying capacity is approached really fast. At the same time, we face very big environmental degradation, accelerating climate change, and nature which will soon respond by trying to control the growing population. Based on what was said before by the whole panel, and based on scientific projections for the future, we will soon face another big pandemic. The intervals between pandemics have shortened, and each pandemic will probably be bigger and stronger and with more impactful than the previous ones. Next pandemics may be caused also due to environmental degradation and climate change. So these issues and all the issues that were mentioned earlier stress for more holistic approaches that they address the sustainability at its real extent and level. We should go away from fragmented approaches. In the current pandemic, we have followed, unfortunately, very fragmented approaches. And what do I mean by that? I will give two examples. We have prioritized physical health over mental and psychological health. At the beginning of the pandemic, there was a very big discussion about how the environment could probably benefit from the lockdowns. Now, after a whole year in the pandemic, we see that solid waste and single-use plastics have increased. So we have an additional environmental issue to fix. And also carbon dioxide emissions from the production chain of single-use plastics also have increased. I believe that in the future pandemics, in the future crises that we will have to face, we will have to go towards more sustainable and holistic approaches. We would have to work towards strategic preparedness plans. We would have to identify and implement financial and policy tools and investments that will prioritize sustainability, environmental justice, behavioral change. Professor Pastides referred to how behavioral change has saved more lives with respect to safety bulbs and smoking than other approaches. He also referred to environmental justice when he said that low-income people may not have access to vaccination and medication, a very, very serious issue and a priority under sustainability. So I would like to either leave these concerns about how we can face a future pandemic in a more sustainable way as a food for thought, or ask one of the panelists, if we have the time, to tell us what would be a priority towards this direction if we could identify how we could prioritize what would be the first policy tools that we should engage into. Thank you.
Apostolaki, I just want to emphasize your point about the prioritization of physical health over mental health And this has been a much under-discussed problem, I think, in Greece and in the United States. We wanted to have the Deputy Minister of Public Health, Zoe Rapti, on specifically to address that issue, because it's been thrown aside and lost. Mental health was such a huge issue for years, and then the pandemic showed up and people seem to almost forget about it. What's going on with people who are stuck in their house? But I want to give Dr. Pastides a chance to answer your question, and it's in this relationship between environmental degradation and a holistic approach to pandemics.
Yeah, it's a very provocative and appropriate question, and I'm going to end it with a challenge to you, dear Professor, and your colleagues. But let me start by saying we shouldn't forget that because of the reduced industrial activity, the reduced attendance in the workplace and schools, this was probably in many ways the healthiest year in modern human record, in the sense of reduced numbers of infections, reduced flu, reduced common cold, reduced dermatologic infections, reduced air pollution, reduced respiratory disease, reduced allergic conditions. Now, nobody is saying, so good, I'm glad we had COVID. That's not what I'm saying. But I'm saying that the environment got a break for 1 year. The environment got a break. The pollution in downtown Athens, the industrial degradation because of reduced human activity, it was a phenomenally good year for the environment. Your question is, what happens next as we return? Can we learn some of the lessons? Can we become more conservative with our resources? Can we be more sensitive to the plight of the poor? That depends on us. There is no panelist and no scientist and no government official by themselves who can address this. My challenge to you and your colleagues is to say that I believe ACG can get a working group together to collaborate with the Greek government, but also with NGOs to begin addressing, before it's too late, by the way, before the return to normal is there completely, and to address ways that we can learn, that we could give our environment a break and that we could try some more sustainable practices. It's a very difficult question. You could see I don't have an answer for you, so I'm turning it back to you.
Well, I think I can speak for the ACG 150 units that we'll be happy to work on that. And that's exactly the kind of thing we are working on. Mr. Doxiadis.
I'd like to give a complementary response from the political economy point of view. One of the effects of the pandemic was that everybody understood that to solve this, you need collective action, and therefore much more public spending. And public spending in the European context on an EU-wide level rather than each country alone. So we have this, by historical standards, huge resilience and recovery fund, which is going to be funded, by the Union, not by separate nation states. But when you place this as a collective action item, what happened in Europe is they said, okay, we'll gather this money, we'll spend it in all the countries, but we cannot let everybody do what they want with it. Let's use this money to solve a collective problem. And what is the main collective problem of our times? It is climate change. And therefore, 37% of these hundreds of billions that are going to be spent have been specifically allocated to green energy and green technologies, and another 22% on moving to digital. So we have almost 60% of these huge amounts of money are going to be spent on actions that are going to be positive for the environment. So therefore, we had the option to have a collection. We had the opportunity to have some sort of huge collective movement, and this is channeled in the right way. So again, I'm being the optimist here.
Excellent. Everybody's going to leave with a smile on their face. I'm extremely happy about this. Thank you, Dr. Apostolaki. I'm going to call on my next, we are actually at time, but I'm going to give us about 7, 8, 9 more minutes if everybody can give us that much time. If you can't, I understand entirely, but I'll ask my colleagues to either ask a question or make a comment. And my next colleague is Professor Yorgos Kokosalakis, who is the Executive Director of the Center of Excellence in Logistics, Shipping, and Transportation. Yorgos.
Thank you, Professor Sammons. Thank you, all members of the panel. for being here and providing us with your valuable input. My role here at ACG 150 is to lead. I have been selected to lead the Center of Excellence for Logistics, Shipping and Transportation. And according to what Dr. Andrade stated already, all three of these areas have been severely affected by the pandemic. We realize that the negative consequences always were somehow, one way or another, tried to be circumvented, somehow tried to be resolved with innovative technological solutions, solutions that Mr. Doxiadis mentioned, like remote controlling of things, or just to provide an example, classification societies at the shipping industry right now, they are performing classification surveys on board vessels remotely from their offices, just to circumvent these traveling restrictions. However, we do have lots of different consequences on all these three areas, and devastation in terms of the financial, the economical perspective are evident. The halting or air travel, severely affecting the airlines. We know that. However, let us see, aside from the economic, the financial point of view, the humanitarian crisis. Public transport has been demonized as COVID spreading health, areas of having people infected, and this is a negative consequence, making all these public transport means not a popular solution anymore. Or at the shipping industry, another problem would be crew changes have become extremely difficult. So you do have crew members on board that their contracts are expiring, and you need to replace them, and no country is allowing them to depart from their own airports. So what can we do, not only for the economical point of view, the financial point of view, but also from the humanitarian point of view, not only in the three areas that I'm representing, but in every aspect? That is a good question, I believe, for all of the members of our panel. Thank you very much.
Thank you, Georgios. I don't know, Dr. Andradis, yes?
I will answer asking to Dr. Pastidis the question, because he mentioned about Florida and all Florida open versus other states. So to make my point, concerning yesterday's UK announcements, which, as we know, have almost single-digit deaths in the last few days in the UK. So my question to Dr. Pastidis is, what does Florida see today versus other states that are not that open?
Well, ironically, Florida is better than the northern states that continue to be more restrictive, although they are opening too. There are a lot of reasons for this, but one of the problems right now is the younger people in the United States, the ones who are most prone to congregating and to doing the more risky things, are also the group least likely to be vaccinated. And I think in the future, we as a society, for example, let me posit this. What if we were to have vaccinated young people first in Greece and the elderly last? You might say, oh, it's impossible because they're at a higher risk of death. Well, as a public health person, I might say they're also more likely to stay home. They're more likely not to break the rules. They're more likely to have others do the shopping for them. And so I'm not weighing in with that recommendation, but I do believe what we're left with today is a very recalcitrant group, young people who are least likely to wear the mask, least likely to play by the rules, who are also least likely to be vaccinated. Now we're getting to them. But having said that, to you, an economist, I have to tell you the proof is in the pudding. The Floridian economy is roaring. The Floridian tax take is #1 right now. And the states that are still slowing and are trying to catch up, they're exporting travelers to places like Florida and Las Vegas, and that's where people are spending their money. So it has to do
I think you answered the point very clearly, right?
Okay.
I want to just point out that Professor Kokosolaki's point about the change in culture and the way that's could potentially affect the economy. Public transportation is going to be looked at completely differently in the coming years. And no one, I think, could have predicted. Think of where we were headed 18 months ago, which was public transportation is the best thing for the environment. It's the best thing for it's the thing, right? That's the future, is public transportation. Now we've got a world where people are afraid of public transportation, and that's going to continue. I don't see that just going away. Even after vaccination, there's going to be a percentage of people that resist it. So I think the point that Professor Kokosolakis is making about culture and our need to try to get ahead of these kinds of cultural changes and see how they're going to affect our economy is quite important. So thank you, Giorgio. I'll bring on my next colleague, Professor Athanasios Christalis, who is the Executive Director of the Center of Excellence for Food, Tourism, and Leisure. And his expertise in particular is in food production, food marketing, and specifically Greek food. So, Thanasi.
Thank you very much, Professor Simons. I would like to visit a topic that I was hoping that you, Jay, were going to actually bring up during the panel discussion, and that is basically responsibility. The term responsibility, and in particular, one type of responsibility that I think is very timely here, and that is corporate responsibility, the responsibility companies from both the private and the state sector have towards the society at large. Within ACG, I represent those two major sectors of our economy, food and agriculture on the one hand, tourism and leisure on the other hand, and within our cultural context, we believe strongly that those two major areas actually coincide and are pretty much aligned with each other. I mean, food and tourism is probably two things, food and leisure and hospitality, other things that actually global people, global tourists would probably find in our place, and the reasons why they would probably like to visit us. So both sectors comprise companies that are major stakeholders in our country, in our nation. They are major employers. They are major state revenue generators. So they are major stakeholders themselves. They actually address other stakeholders, public, social, business stakeholders. So altogether, all these companies have been put under scrutiny constantly by the public, criticized severely on actually lacking a sense of responsibility, especially in terms of crisis like the one we actually live in. At the same time, this same public seems to be reluctant undertaking its own responsibility, and it's not a mistake, it's not a lie, if we admit that in Greece we're having a problem of accepting our responsibility as individuals and as citizens. So we criticize easily others, most importantly companies that provide jobs and make revenue for the state treasury. On the other hand, we have difficulties in accepting our own responsibility. So I have two simple questions. I hope, Jay, I have the time to actually address both. I'll try to make it fast. So the first question is, would you agree that responsible companies must be rewarded financially only because they are responsible? Should responsible companies make profits, make money out of that? Or we should see responsibility as a matter of ethics? And accordingly, we all, including companies, must be responsible without necessarily looking for profits. So I would like to address this question ideally to Dr. Andreadis, if it's okay with you. And then I'll ask the next question. Thank you.
Very briefly, because I think we ran out of time. I fully agree. Look, as Mr. Doxiadis explained, companies have, and including my company, I mean, we are probably the first Greek tourist business with zero carbon since last year. And, we are moving very fast to become zero plastic and zero waste in the next couple of years. So this is not because only we think this gives us a huge commercial advantage and a huge attractiveness as brands, is because actually there is a lot of investment and interest to like green bonds or other ways to improve your margins, your leverage with better terms if you agree. So first of all, there are instruments in place for companies that want to do it. And the most important is you address a very, very important aspect of demand from guests who just demand that you are, going that way, that you are socially responsible. And of course, they are very interested to see what are your other social responsibility steps. So I don't think it's a no-brainer. Honestly, it's a no-brainer. It's only a question of the structure of every business, the size of the business, because obviously smaller companies don't have the right resources to go and work in the same way. And that's something the state has to help. So the answer is, it's something that is happening already. It has to speed up. Carbon emissions have dropped a lot, as Dr. Bastidis explained, but plastic certainly has spread all over the world, because we can only think of how much plastic we've used with all these masks and all this packaging. Wherever you go, you have a plastic wrap around anything you can imagine. Imagine that billions of tons of plastic that have been gone all over the world to the oceans ultimately. So the zero plastic will be one big, big issue coming tomorrow, and better every company has to address that.
Yeah, I think Professor Christalis, you've opened a subject here on responsibility, corporate, public, and personal, that we should do an entire event on. That's an excellent, but I'll give you a tiny space, 30 seconds for a second question if you have one.
Okay, thank you. Just out of curiosity, I'm going to address that to Mr. Doxiadis. Would you see a role for state-controlled companies in that sense, in terms of responsibility, being the same, smaller or larger, to the role played by the private sector of the economy? Thank you, sir.
Well, I think actually it's easier for them because, they can balance their main stakeholder, economic stakeholder is the state, and the role of the state is much more geared towards societal goals than usually private enterprises. So yes, if you're talking about the Public Power Corporation, for example, or the water company and so on, I think that their role should be increased in this sense.
Great. Thank you, Professor Christalis. I'll bring on my last colleague, from the ACG 150 unit leaders. This is Professor Konstantinos Papadias, who is the executive director of our Research, Technology, and Innovation Network. Konstantinos.
So thank you very much, Jay. Thanks to all our esteemed panelists. You made some excellent points. Being last in the row, it's hard to make a new point, but since I represent the research and technology-based innovation component, I cannot but echo the comments by Professor Demitzakis and also by Mr. Doxiadis regarding the role of research and science and technology in all of this. And perhaps also to end it in a positive note, my view is that science technology has fulfilled its role in this pandemic. It has stepped up to the challenge. The international scientific community has come together. It's perhaps, we take it for granted, but all this information technology and information communications technology that is behind has been helping many sectors to remain afloat. Education has stayed there due to e-learning and all the platforms and the networks behind that support it. The fact that we can have this event here in such a great way is due to the networks that are behind and keep serving all the needs. The fact that that several vaccines actually were developed in such record time, from what we understand, is almost a miracle that is due to to science and technology. That is the positive takeaway that I keep from this whole pandemic. Now, and of course, it will continue. Now, another very interesting point, though, that Professor Pastidis made is that low tech also can have an impact, and sometimes an even bigger impact than high tech. And he mentioned, seat belts and tobacco awareness as two, let's say, low tech approaches that had a very large impact. And it's clear that the analogy here is the masks, right? Wearing a mask is a low tech device, but it has a huge impact. The key, though, to those low tech approaches in becoming successful is the cooperation of the public. And this is the point I want to make. And perhaps the question to ask is, do you feel that the public's awareness of the role of science and technology or the scientific community has been elevated during the pandemic? And the next question is, do you believe that the public will become more prone to taking scientists' opinion and advices more seriously, perhaps? So that's my final point and question.
You may be disappointed to hear that I think that society has become overly dependent on technology, in that nothing before the vaccine gave us the hope of this pandemic moving away. And in fact, the simple behavioral practices that we adhered to before, in spite of the fact that the virus was never going to be on a surface and lasting for days, this was nonsense and really not technical at all. But the hand washing and the social distancing saved many thousands of lives, who knows how many. And so I worry a little bit, while at the same time our newfound respect for vaccine platforms and distribution and manufacturing and all of this has skyrocketed. At the same time, people will I worry that they will let their guard down and say, next time it happens, I'm just going to hang around because nothing's going to help me until the major pharma comes in with their vaccine. So it's a double-edged coin, I would say.
Well, very interesting point. Professor Demizakis, do you want to answer that?
Yeah, I agree with what Professor Pastidis said. I just want to add that I think the jury's out on what's the public perception for science. I think that we'll have to see, and I think that different countries and different societies will have different response to that. And I think it's our responsibility as scientists and researchers to make sure that we try to maybe correct some of the weaknesses that were presented in order to keep the excitement and the respect that the public has for science, but now with more understanding. I think that there's a lot more understanding now, but that understanding is not well placed, is out of context, and we should help the public to bring it into context. I think the other thing to keep in mind is that, we're talking about high technology, low technology kind of solutions, but the realization that low technology solutions work is by using high technology research. And so in some ways, the ability to evaluate what works, what doesn't work, our knowledge about things, and the organization of that knowledge is something that I think we can do better next time in the pandemic. And one final point to address an earlier point that you made about uniformity of approaches. I think what we need, in particular in science and research, this is important. We don't need uniformity, we need coordination. Every country, every group, every center can do something different. But if it's done in a coordinated way, at least we're going to have a complete picture, rather than everybody doing the same thing and leaving lots of things that we don't do completely out of the funding or of the approaches. So this is something that we need next time. Science was not, as well as many other things, was not as well coordinated internationally as it should have been to find not the solution, which is the vaccine, but more the deep understanding of the interactions of the virus with the human and other types of aspects of transmission.
It's an excellent point, and maybe on the note of coordination is a good place to wrap up our event today. Thank you, Konstantinos. I want to thank an amazing panel. It's been a real pleasure. Each of you have really added a lot to the conversation. Professor Alivizatos, Dr. Andreadis, Professor Demizakis, Mr. Doxiadis, Dr. Pastidis. It's been a pleasure to be on this panel with you today. I'll just say that the kind of teaching and research that we're doing at ACG and specifically in the ACG 150 units is designed to try to provide the kind of data and research that our policymakers and the public need to address these kinds of issues in the future. There's got to be people that can provide our policymakers with the information they need, and the public, of course, needs to be informed, and the media needs to be reformed. I don't have any problem saying that, but I think that this is exactly the charge you gave us, Dr. Pastidis. We will take seriously and work on it. And now, as we close, I'll just end with my secret goal for this event, which I didn't share with any of my colleagues or any of you, was that we would actually show Americans, some of whom will see this, that you can have a civil conversation between rational, sensible people on the subjects of the relationship between public health, political liberty, and the economy, and that everything doesn't have to be siloed into politicians or individuals who are zealots taking one position and not willing to talk to the other side. And you all did an amazing job, I think, of modeling the kind of conversations that need to go on from here on out as we prepare for the future. So I'll just say once more, Greece has proved to be the Paideia for the rest of the world. And thank you very much.
Thank you.
Thank you.
Thanks.
Thank you all.